5 years of pretending to care about the OSCE patient's abdominal pain.
Yeah, I've just got this tummy pain, just in my right side. Yeah, it's just really hurting me.
Oh my god, I'm just so sorry about your 3 out of 10 right upper quadrant abdominal pain. What are we gonna do? I'm just devastated. I'm so sorry. No!
5 years of coming out of that exam hall and finding out you've got 50% of the questions wrong.
Yo, listen, yeah, what did you get for question 2?
I got streptococcus pneumonia for the Sonia.
No.
It's hemophilus.
Yeah, that is the right one.
No, yeah, I was a diplococcus, man. What are you saying?
Yo, T, what you saying? What did you get?
I actually got paracetamol.
Oh, you're thick, Yara. You're actually thick. Bro, Kasme, that wasn't even an option, man. What's this guy on? Yo, bro, you're feeling okay.
Well, now you've made it. You finally graduated, and now you're a doctor. So now you finally become a doctor. You've graduated. Your graduation was so nice. You made your parents proud. It was all going so well till you got on the ward, and you received the biggest emotional enema you've ever received. 13-hour-long shifts, night shifts, dying patients, and social hours, stress. But guess what? I don't have to be stressed. I get to be stressed. But don't worry. Shh. Because I'm here. And I'll be sharing everything you need to know about how to survive your first year of being a doctor. First thing, efficiency is important. Okay, I've done the ward round with the consultant. Before I'm documenting, I'm ordering the scans. I'm calling radiology to confirm if the scan can be done today. And then I'm documenting that. I'm ordering the bloods so then I don't have to take them because the phlebotomists, they're gonna take them. Sick patients / urgent interventions or scans, patients going home, everything else. That's your order that you should be prioritizing in. And some people get annoyed because nurses can often be on your case for completing discharge letters and TTOs, but they have a point. There'll be sick patients waiting to be admitted to your ward, and there shouldn't be any unnecessary delays if you can help it in getting other patients home. There needs to be a flow of patients in order for the hospital to function. Being slick with the system is really important, knowing how to order certain scans or investigations and how to prescribe certain treatments. But don't worry, all of this will come with time. You will learn. Second thing, remind yourself that this is a massive blessing. You idiot! You're complaining so much about this and that and this and that, and you're not reminding yourself of how much of a blessing it is. You're not reminding yourself of the patient you gave furosemide to because they were in overload and you saved their life. And that someone was someone's mother, someone's father, someone's child, someone's sister, someone's brother. You are making a massive direct impact to your community and the people around you. You are making a difference. And it's important to remind yourself of that because it will get you through the tough times more easier. Working as a doctor is completely different to being a medical student. Medical student me, I was just trying to scrape exams. I really wasn't really passionate about anything, to be honest. Doctor me, I would say, passionate about helping people, and I want to be a good doctor. So now the reason why I'm learning new knowledge as a doctor is not so that I can pass exams, it's more so that I can help human lives. So don't worry if you're in medical school and you're finding it difficult, you're thinking that this is not for you. Being a doctor is completely different. It's a massive blessing. Third thing, the job isn't actually terrible. Now, I guess it depends on where you work. There are some doctors that have it more difficult than others, but I can say in my experience of being an F1, overall, I've enjoyed myself so much. There are some days where I'm chilling. I am chilling, like there's not much to do because I've done my jobs. It's not a constant enema of just stress, bam, 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 boop, boop, boop. It's not like that. Sometimes there's a bit of jazz. Sometimes you're just sitting in the office and sipping on your tea and just reviewing stuff. Okay, that blood looks normal. Sometimes I finish quite early, and you guys need to hear that because I feel like there is this perception life as an F1 doctor is constant chaos. It really isn't. And for doctors who are working now and they feel like it's constant chaos, it needs to be escalated.
Get some help.
You shouldn't be bombarded and feel like you're leaving the hospital like on fire every day. You should be saying, what the flip is going on? Okay, someone sort this out. Someone clean this all up, okay? We need some more doctors, we need some more locums, we need some more support. That's what should be going on. You know, over the past year, I've made so many friends. I've made so many nice memories in the doctor's office. I've had so many jokes. I've laughed so much. I've enjoyed myself so much this past year. So please, don't think that it's going to be constant chaos, constant stress. It's not. Fourth thing, be nice to nurses. Why are some people just not nice to nurses? Just stop it. We need to work together. You see this? Teamwork. Scratch their back and they will scratch yours. You don't have to be extroverted or chatty or handsome and lay so much riz like me.
Stop the cap.
Okay, you can be just your normal self, but just be nice, make conversation, be a bit social. And if they're concerned about someone, go see the patient. It's just a sign of respect also. Not only are you caring for that patient and reassuring them, you're listening to that nurse. Because then otherwise, if you're not going to listen to them, then why should they really respect you back? Why should they really listen to you back? So please, work nicely with the nurses because it will help you so much. And also, it's just the right thing to do. Fifth thing, ask for help. Any senior who gives you bother for you asking help, just chill out. Because then guess what? The next time a patient is sick and your junior is too scared to ask you for help, that's your fault because of how you've acted before. I still get it sometimes, even after completing F1, I still feel apprehensive calling a senior sometimes for help, but you just have to do it. If you're unsure, and even if it's just to confirm a plan, you always escalate. And especially as an F1, you guys don't know, everyone knows the F1s are babies. And I mean that with all the respect, but you guys are just starting out. And it's also good to share the responsibility that I've discussed it with so-and-so, so it's like a joint decision as well. Sixth thing, know how to deal with emergencies. A to E, just apply that to all the different medical emergencies. A, are the airways patent? Boom. B, listen to the lungs. Oh, there's some crackles, there's some wheeze. Let's get a chest x-ray. Oh, they got a drop in the oxygen sats. Let's bump up the oxygen and let's do an ABG. C, heart sounds. What do they sound like? Oh, cool, normal. Are they warm? Are they perfused? What's a cap refill? Do an ECG if you need to as well. Their pulse is okay, their heart rate okay. D, okay, what's their like alertness? Are they alert? What's a GCS? Are they able to like move all limbs and stuff? Their pearl and stuff. Is their BM okay? E, anything else? Bruising, bleeding, rashes, feel of their tummy. What's their legs saying? Is it cough, soft non-tenders, any swelling there? What's their urine output saying? Guess what? This patient who's short of breath and they've got crackles and they've got peripheral edema and they've got a background of heart failure. Oh man, it looks like their chest x-ray is a bit congested and their ABG is in type 1 rest failure as well. Okay, let's just bang some furosemide because their blood pressure is like 120 so they can handle it. And bappity boopity boop, call the med reg, and then flipping he's gonna be like, I'll read mate, how worried are you about this patient? Oh, I'm actually kind of pooping myself right now. You're not expected to make advanced management plans or even to always know exactly what's the problem. Even consultants and seniors, they don't know exactly what the diagnosis is initially. But you as an F1, just stabilize the patients, do the basic interventions, do the basic investigations. And then when you go to the med reg with a chest x-ray, with an ECG, with having taken bloods and then an ABG, that's all amazing information for the med reg to interpret and think of differentials and give sort of some advice on management or to see the patient. Chest pain, people panic about chest pain. I remember the first time I got chest pain on the ward, not me personally, because that happens every day. But when a patient got chest pain and I was panicking, I was like, yo, what the flip? This is an MI happening? It was reflux. Okay, so it's not always the worst thing. It's not always a PE. It's not always a heart attack. Have a wide differentials. It can be a respiratory infection. It can be anxiety. It can be reflux. It can be MSK pain. And don't worry as well. You will learn over time how to deal with these just through experience. That's the best way that I learned how to deal with certain conditions. Seventh thing, portfolio. You should have done something similar in medical school where you get like these CBDs and mini caxes and DOPs. And I really can't be bothered to speak about all of that. So this is a website, just flip in, go on that and just read that. Eighth thing, maintain a good work-life balance. Gym, martial arts, footy, social things. Don't just work all the time, especially when you've got 4 consecutive 13-hour shifts in a row. You need something to look forward to at the end of those shifts to get you through them more easily. Annual leave, you can use that so nicely. So for example, in a week I only was working 2 days and then I had a STT. So just from 2 days of annual leave, I got the whole week off. Granted, STT, you need to be within reach of the hospital in case they call you in for low staffing, but the staffing wasn't low, so I actually got the week off. And because I'm making money, then I can travel as well. I've been to a few different countries. That's really nice as well. And even during work, make sure, please, to take breaks. If there isn't anyone who's gonna imminently die in the next sort of like 30-20 minutes, take that 20-30 minute break because you need it sometimes. You need it to come back more refreshed. Just keep hydrated, drink lots of water and go off, cool down, and then come back. You'll be much more quicker with your jobs and you'll think more clearly. And the last thing, how to deal with anxiety. In the first month, my arm was shaking because I was so stressed. I lacked so much confidence and I was doubting myself so much. I was having anxiety. In some huddles, where you present patients to everyone and the nurses, I would be stammering, I would be choking up on myself. My heart was beating so quickly as well. Honestly, I was really nervous. But your boy built his confidence back up. How did I do that? A, with experience and after asking questions, I became more confident. You have to take the responsibility to help yourself and just ask questions from other people. And the more knowledge you acquire, the more confident you'll be at dealing with certain things that would stress other people out. B, your perception of yourself is so important. If you perceive yourself as someone who is nervous, as someone who doesn't know what they're doing, then you will be that person. But if you perceive yourself as someone who does know what they're doing, someone who is confident and who can deal with the work, then you will be that person. Have realistic expectations as well. That's something that's helped me deal with anxiety. If there's a really, really busy shift, there's all these jobs to do, then I have to just accept I might not get all of them done. But guess what? I'm gonna get the important ones done. Some little other jobs, they might not be done straight away. There might be a bit of a delay, but I'm only human. I'm not Superman. I can't work at super speed. And just talk, please. If you're struggling, vent. You need to vent. Especially to someone who knows what you're going through, like another doctor. Tell them all about your crappy day, because then all it takes is for someone else to say, you know what, that was a really tough shift. I would be feeling so crap as well after that, but guess what, you did a great job. You ordered this scan, you got this patient discharged, you looked after this sick patient, you did all the right things and you escalated, and you will feel better, I promise. So with experience and time, you'll feel better after asking questions and have a good perception of yourself, have realistic expectations, and talk. Vent. You guys will be fine. Don't worry. If you've passed medical school, you deserve to be here. And hey, if I can do this job, then anyone can. You guys are good. You guys have got it. Keep learning. Keep enjoying. This is a massive blessing. I've got to go to work now. So subscribe, comment, like, and I'll see you guys in the next one. Peace. Assalamu alaikum.